visual careers, hard driving recreational activities, the gentle act of reading, and the art of glamour. For reasons ranging from safety to convenience to vanity, people consider refractive surgery to achieve better vision without glasses. Brian Finrow was one of those people.
I wore glasses since I was 12 years old, so every morning I'd wake up, slide those babies on, cleaning them all the time, knocking them off when I'm doing active things.
Active is key to describing Brian. He felt that wearing glasses slowed him down.
In the wintertime I do a lot of skiing, and that's a real problem because you've got the glasses and you've also got the goggles, and when it's wet outside you got the fog and everything's fogging up and you're stopping to unfog things, and then the rain gets inside and it fogs faster. It's terrible. And then I also climb, so you can see the problem right away. If you're crawling up the side of a mountain like this, kind of pressed in, the last thing you want is to have your glasses right there. So it was really a problem in a lot of ways for me.
Contact lenses would solve that problem for some people, but not everyone can wear them comfortably. Contacts never worked well for Brian, so he began to consider surgical options, but had some concerns.
It seems kind of a risky thing to do, kind of having somebody messing with your eyes. It's kind of imposing if you don't know anything about it. But just a year ago I decided finally, after having some troubles, I had a near accident climbing, so I decided, well, geez, I really need to think about this, because at that point it becomes a choice of the lesser evil, right? I mean, do I want to have the risk of having a climbing injury or something like that, or do I want to maybe talk to some people about getting this problem fixed?
Brian did some research on his own. Then a friend referred him to Dr. Shen at the University of Washington Medical Center's Refractive Surgery Center.
What I found very valuable about talking with Dr. Shen is she sat down with me and she walked me through, here's A, B, C, D. These are the things you need to worry about, and here's a very small risk, but they're there, and these things do happen to people even, no matter who your doctor is. But then also there are these other few things that you may have heard about, and those are not risks. These are things that were risks with old forms of the technology. These are things that have been been eliminated as risk because of the march of technology and all the rest.
Brian chose to go ahead with a procedure called LASEK, which is newer than the well-known LASIK and has less potential for complications. LASEK is an acronym for Laser-Assisted Subepithelial Keratectomy, and it's performed as an outpatient procedure with only local anesthetic drops in the eyes.
How are you feeling?
You're aware and awake the whole time. One thing that's very helpful is that they talked me through every step of the way, which was very reassuring. So I always knew what was going to happen next, and as it was happening, and then how far we were along in the process. And it was all just a very interesting process to observe, actually.
It's been just over 3 months since Brian's surgery.
Morning, Sean. Morning.
He had a week of recovery with dry, itchy eyes, but since then, all is well.
Oh, it's fantastic. Actually, one of my favorite things now, as it turns out, this is a surprise to me, but one of my favorite activities now is buying sunglasses. Because you can't imagine for 20 years not being able to buy sunglasses, and now it's like the world is my oyster. So every time we go into a gas station on a road trip, say, I go to the rack, where they have all the $10 sunglasses, and I get to look through them all.
Sounds pretty simple. Have the surgery, throw away your glasses, enjoy your new vision. And for Brian, it was. But before going ahead with a surgery that permanently changes your vision, there are things to consider. At the University of Washington Medical Center's Refractive Surgery Center, patients participate in a multi-step process before surgery.
And then look right at the red light when you see it.
Doctors make certain that patients are good candidates, are fully informed about what to expect, and make choices that best fit their lifestyles.
We have a whole team in Refractive Surgery Center to help the patient to get all the information they need, from the history of wearing glasses and stability of their their refractive errors, to their expectations, their needs, and why they wanted to have refractive surgery.
And then switch to the other chin rest.
Then we do a whole battery of tests, and Dr. Ross, who's our optometrist here, consult the patient and analyze the data. We decide at least the health of the eye is permissible for surgery.
Preoperative testing includes corneal topography to examine the curvature of the eye, as well as the health of the eye's tear film, which protects and lubricates the cornea. The topography also maps out points on the operating area of the cornea. Patients who use contact lenses are required to stop wearing them prior to testing.
If you're wearing contacts, soft lenses, you should be out of them for a week. But if you're wearing rigid lenses, 3 weeks. Also, if Dr. Ross finds that your eyes are dry, she'll probably want to rehabilitate that before you have surgery.
Eye drops, diet changes, and warm compresses are some of the treatments that may be used to rehabilitate the eye's natural tears. Testing may also reveal that an individual has pupils which dilate too widely in low light. In that case, refractive surgery is not an option because the patient would have too many postoperative issues with glare and halos at night.
You see patients going through the pre-op procedures and they have their eyes checked in many different ways, usually a dozen ways, and different ways we do it is to acquire many different angles to the cornea to create a topography of their eyes that's individual to that patient.
The wave scan looks at patients' prescriptions. Stable vision is essential for a refractive surgery candidate, and for most people, that happens by their late 20s.
Go ahead and blink.
If someone's eyes continue to change, however, contact lenses would be a better option than surgery.
And eyes wide open. Don't blink, don't move.
Dr. Shen's team checks a patient's prescription 4 times to be certain it's stable.
Then the next step will be trying to recreate what surgery might bring to their lives.
You can go ahead and slip on.
Our team members, we share the same philosophy. We really want to emphasize that the decision-making process is a mutual process. Our patient has much to say about what they want as we have to recommend. A lot of times it's a learning process for us as well because each person's different.
When a patient first comes in, ultimately what my goal is to get to know the patient and to know their specific visual demands, both at work and then outside of work. So I spend a lot of time, asking them specific questions about their tasks at work and specifically how they're using their eyes.
I was working in accounting, so I spent the entire day in front of computers, and then when I'm not in front of computer, I'm reading reports, a lot of financial reports, that kind of stuff.
Jack Chen is an outdoor guy in an urban setting. He wants the convenience of not wearing glasses when he hikes or having to carry an extra pair when he travels. But he's at an age when full correction has its drawbacks as well.
When we're dealing with patients who are over the age of 40, we're also dealing with the issue of presbyopia. And presbyopia is that normal aging change where you lose your ability to focus up close. So generally, I will let patients know that there's 3 different routes of how we can potentially correct their eyes. The first route would be to get rid of all of their distance prescription, and that will essentially make everything clear for them far in the distance, beyond arm's length. But everything arm's length and closer, they will end up needing some sort of magnifying lenses.
That means wearing reading glasses for any close-up activity. A second choice is to try undercorrection in both eyes so that middle distance vision is still functional and reading glasses would be needed less often. The third choice involves a different level of correction in each eye.
This is called monovision. And what monovision is where we correct the dominant eye so it's sharp for the distance and the non-dominant eye so that it's sharp for up close. And this is more of a functional vision so that you can drive comfortably, recognize people's faces, see your television, see your computer, a watch, a menu, without needing any type of glasses.
It sounds a little unbalanced, but for most people, the brain makes adjustments so that monovision works.
It really depends on how you use your eyes. There may be some people in specific fields which monovision does not work for them, such as people that do a lot of stitching or sewing and really need that precise depth perception, or someone who does a lot of night driving. But people are very surprised when they actually try it out in a contact lens and realize that they're perfectly comfortable with it, and it gives them a lot of freedom from needing any glasses in any type of distance.
Knowing what to expect is essential to a happy outcome. If a nearsighted patient with presbyopia decides on perfect distance vision, close-up vision will no longer be possible without reading glasses.
And that's something that is critical for patients to have a good understanding when they're deciding refractive surgery. Because if they do get rid of that nearsightedness, they may end up seeing very sharp in the distance, but inevitably all of a sudden, when they're sitting at their computer, they have to put on some sort of reading glasses.
Because refractive surgery offers so many vision options, the University of Washington Medical Center provides pre-surgery contact lens trials to all their patients. This helps patients make the best vision choice for corrective surgery. For the last few weeks, Jack has been trying various levels of distance correction to see what works for him.
The first pair of contacts I got was for full correction. And I put it on, and then it's wonderful when I'm driving, but I couldn't see my dashboard. I couldn't read, and so I don't think full correction is gonna work for me, because then I do read it out, and then I had to carry a pair of reading glasses all the time. I think that would defeat the purpose of getting my eye corrected.
With the contact lens trials, I always let them know that whatever contact lens we start off with is just a starting point. And what I ask them to do is go home and do all the tasks that you would normally do at home. Go to work, do all the tasks you normally do at work, do all the hobbies that you like to do, and then come back and let's talk about it.
The prescription seemed to be working for me.
In his second round of trials, Jack's trying monovision, with one contact lens fully correcting the vision in his dominant eye and the other eye undercorrected.
I could drive, and I could see very well. I could read very well, but still, the distance was still a little too far for me to read, like 12 inches. So I told Dr. Ross I kind of want to improve the reading part of it. I'm gonna move it maybe to, so I don't have to read at this, a little more comfortable distance.
A little more fine-tuning brought Jack to a comfortable level of correction.
We're evaluating that distant vision, the intermediate computer, and the reading vision.
Yeah.
You felt that all of those ranges were functional for you?
Yes. The computer, the reading, the driving, regular. I even went to see a movie.
For patients who have trouble with contacts, Dr. Ross and her team find ways to make the lens trial comfortable.
We choose specifically FDA-approved contact lenses that are okay for them to sleep in, and we make it easy for them where we will put it in your eye and we will remove it so they don't have to worry about that step. Because that's also something that's a big concern of patients, when they come in and I tell them about their options and then I tell them, well, we can do a soft contact lens trial. Then sometimes they get a little nervous and say, well, I can't get a lens in my eye, that's not going to work. And so we really work with them, and we haven't had a patient yet who we haven't been able to do the contact lens trial who didn't want to do it.
Rebecca Hughes, a writer, has chosen monovision correction for her upcoming surgery. She recently completed her contact lens trial.
It was a very collaborative process. Because I'm a science nerd, I was attracted by the idea of really fine-tuning it and trying a little up and a little down from the prescription that she started out with. And even at one point, I switched what I thought my dominant eye might be.
Good morning. How can I help you? Good morning.
Like Brian, Rebecca will be having LASEK surgery.
Okay, you're seeing Dr. Shen today?
Again, this is a newer procedure than LASIK, and although the names are similar, the surgeries are quite different.
LASEK is a laser refractive surgery where the laser is applied to the surface of the eye, rather than LASIK, where the laser is applied underneath a flap.
LASIK surgery involves cutting the cornea, creating a thin flap. The flap is lifted and the laser is applied, changing the shape of the cornea. Then the flap is replaced.
The advantage of LASIK is that you're going to see better within a day or two. But a disadvantage of LASIK is that, what we're finding out now is that mechanically the eye is overall weakened.
With LASEK surgery, the cornea's surface epithelial cells are peeled back in a single sheet rather than cut. After the laser is applied, the cells are moved back to their original position.
The advantage of LASEK is that as soon as those epithelial cells grow back, you have no risk of flap complications. The only disadvantage of LASEK versus LASIK is instead of seeing better in a day or two or feeling better in a day or two, it takes more like 4 or 5 days for you to start to feel better and start to see better.
The majority of our patients choose LASEK once they understand the pros and cons of the two procedures. Many of them are very active in the Pacific Northwest, and they have a lot of activities that might subject them to trauma. So LASEK will be a little bit more conservative and leave more corneal tissue behind. And also there is no extra flap in the eye after surgery compared to LASIK, where the flap will be there forever. So sometimes if they're subjected to severe trauma, car accidents, or even a kid's finger in the eye, anything that could perceivably happen, LASIK will have more problematic outcomes as complications years later. Hi Rebecca, how are you? I'm Dr. Shen.
On the day of surgery, Dr. Shen makes sure Rebecca knows exactly what to expect during her procedure.
So there's one thing I want to make sure you remember is there's nothing you do today will make any difficult outcomes for your eyes. So basically nothing you can do for surgery today will mess things up. I'm not using any sharp instruments, so nothing to worry about. And the other thing I want to make sure you know is you can talk to me throughout the case. I think that it's comforting for me to be able to tell the patient that whatever you do, there's no long-term damage resulted from those unexpected motions if they do, because everyone going through surgery, they're nervous, and sometimes we can't expect them to do exactly what we tell them to do.
The entire procedure takes about 20 minutes from the time Rebecca enters the room.
And numb your eyes or what?
With the anesthetic drops in her eyes, Rebecca won't feel anything more than a little pressure during surgery. Her eyelashes are taped back.
That's perfect. What I'd like to do is to give you numbing drops as we go along. Just make sure you're absolutely comfortable, okay?
A lid speculum, a wire clamp, is positioned to hold her eyelids open during the procedure.
Raise your eyebrows for me really wide and open both eyes for me, dear. That's good, and look straight ahead. Perfect job, that's it. You're doing great.
Next, Dr. Shen marks the cornea with purple dye.
The marking of the corneal surface serves two purposes. When I mark, I can test how well their eye is numbed. The other thing also is to give us orientation of the eye so that we can align them in the correct way. And right now, what you're going to see, Rebecca, is that we're starting to process the surface cells of the eye.
Rebecca felt no pain while the epithelial cells were moved aside.
From your point of view, you will see a little bit of distortion as if you're seeing a little curtain come across your field of view. Okay, that's the surface cells are very thin. They're about 30 to 40 microns thick. You are going to see the cells being gently reflected, and they sort of rolled back in front of your eyes as we speak, and it's going beautifully. You're doing great. It's a big deal to go through eye surgery. I think that we as a refractive team trying to do everything we can to make the patient feel at ease, because their trust makes surgery goes very well. How are you doing there, Rebecca? Doing okay?
Thank you.
Good. Perfect. What we usually try to do is to communicate with the patient, make sure they understand they can talk to us during most part of the surgery, and they feel much more at ease. If there's anything that concerns them, they can let us know. And we give them as much information as we can prior to surgery, so they come in well prepared. This is a good time to let me know, Rebecca, if there's anything that bothers you, or if you need to clear your throat and move around. And after that, when the laser goes forward, I'm going to ask you not to talk and breathe normally as you look at the blinking light. Here we go, 47 seconds to go.
Rebecca's dominant eye will receive 47 seconds of laser treatment. This is the time when patients are asked not to move. Dr. Shen often places a hand on patients' foreheads to help them stay still.
What the laser does is what normally a surgeon wish she or he has the hands to do, is really to precisely carve the corneal surface in a desired way. Perfect. And what the laser beam does is to very precisely, micron by micron, to reshape the cornea during that time.
It didn't hurt at all, and as I looked at the light, it became clear. It went from fuzzy to clear.
Rebecca's left eye will need only 30 seconds of laser treatment, since she's using that eye for monovision.
Beautiful. That's great. Less than 25 seconds to go now. You're doing beautifully. That's great. Perfect centration. That's excellent. Less than 15 seconds to go now. Last 10 seconds. We're almost there. Doing great. Perfect job.
When the laser treatment is finished, Dr. Shen replaces the epithelial cells over the cornea. Rather than touching the delicate cells again, she uses a wave of fluid to move them gently back into place. Antibiotic drops and a bandage contact lens complete the procedure.
Congratulations, you're all done.
Thank you.
That was great. You did perfect. How was that?
Good, thank you.
Excellent. Now you can sit up whenever you're ready. Can you see your husband?
I can.
So you notice that your vision has changed already.
Yeah.
However, everything's a little fuzzy.
Yeah.
Rebecca's vision will be a little fuzzy for a few days, as if looking through fog. Her eyes will continue to get better over the next several days.
Recovery time, we usually really would prefer the patient to spend a week away from work. Partially it's physical, partially it's psychological. When you have eye surgeries, there are many things going into healing. Last thing we want them to do is to worry about work or other obligations.
So Rebecca, we like to make sure that you have a good understanding of what to expect this first week after surgery. And generally those first 3 days are going to be the most difficult time for you. You're going to have a lot of visual fluctuations, and you also may have some discomfort. Some people have compared it to cutting onions for 3 days, where your eyes are watering and they burn and are a little bit irritated. And that's a normal part of the healing process due to some of the dryness that you experience.
There will be medications to take and eye drops to use. As with all refractive surgery patients, Rebecca will need to be driven home today.
So these are the outdoor ones.
But during her recovery, she'll be able to do most things on her own.
They can, go for a walk, they can do tasks. We encourage them to get books on tape, to plan on listening to music. We just don't want them to be truly engaged in any activity, because when you're engaged in a particular activity, you don't blink as much. And when you don't blink as much, you're going to exacerbate that dry environment.
Rebecca will return for 1 day, 1 week, and 1 month follow-up visits. After that, she'll be in every 3 months for the first year following surgery.
We always follow our patients for the first year after surgery, just in case their healing process is a little unusual compared to the normal population, or any other questions of their eyes that we need to take care of. So they can come to see us as often as they want during the first year as part of the surgery.
Rebecca needed a week of recovery before she could work effectively or go back to her other activities.
It definitely took that whole week of listening to books on tape and wearing dark glasses and not reading, not using the computer, for me at least.
2 weeks after surgery, Rebecca's vision is dramatically improved.
For far away, it really does seem as close to perfect as I've ever been with glasses or contact lenses. In the morning, I can see my alarm clock across the room without glasses. That's exciting.
Last set, right and left.
Rebecca's monovision is still adjusting. She can see her computer screen clearly, but may eventually need glasses for reading books or focusing clearly on things that are very close to her face. She's comfortable with that possibility. In the meantime, she's thrilled to be able to attend her Nia dance class without wiping sweat from her glasses. And as for her surgery, she'd do it all over again.
Dr. Shen really inspired confidence. She just seemed really masterly with what she was doing and somehow managed to do it while soothing me and calming me and checking in with me the whole time. So it was amazing. Yeah.
For more information or to make an appointment, contact University of Washington Medical Center, Refractive Surgery Center, www.uwlasik.org, 206-598-2020.